This is me Arju here and I welcome you to my channel Mr. Teeth, where your dental concept get dissected. So this is our part 3 video of the oral mucous membrane, and we have covered keratinized oral epithelium in the previous video. So in this video we will be discussing with the difference between the keratinized and the non-keratinized epithelium, so that the points of the non-keratinized epithelium would also come in this video. Okay, and after that we will cover basement membrane, and after that lamina propria and the submucosa, and in upcoming videos we will be covering other remaining topics of this chapter. Okay, as this chapter is one of the greatest chapter of the greatest and longest chapter. Okay, it is a too long chapter of the dental histology, so I have divided all the topics in different parts, so I will be covering as such. Okay, so without delaying much, let's get started. So in this video, as I have written here, non-keratinized epithelium, keratinized epithelium, basement membrane. Okay, so first of all we will discuss with the difference between this keratinized and non-keratinized oral epithelium. So in keratinized oral epithelium, as we can see here, okay, so location, first of all location. So in the first video, in the classification section of this oral mucous membrane, there I have discussed. Okay, so I have masticatory mucosa, specialized mucosa, okay, and lining mucosa. So this masticatory and specialized mucosa contain this keratinized oral epithelium. Okay, so gingiva, hard palate, and dorsum of the tongue have this keratinized oral epithelium, and non-keratinized oral epithelium it is present in the lining mucosa. Okay, after that in the layers, okay, so we have 4 different layers in keratinized oral epithelium, and we have 3 different layers in non-keratinized oral epithelium. Okay, after that in the function, so keratinized oral epithelium withstand the mechanical stresses, chewing and friction, and non-keratinized oral epithelium, it provides the flexion and cushioning effect. Okay, so keratinized oral epithelium are mainly for the resisting the larger forces. Okay, but this non-keratinized oral epithelium are for the resistance to the lower forces like this flexion and cushioning. Okay, so cushioning means it gives the cushioning effect, but it resists the lower magnitude force. Okay, after that in fourth point, surface layer. Okay, so surface layer means stratum superficiale or the stratum corneum. So stratum corneum or the stratum superficiale. So especially stratum corneum we use in keratinized oral epithelium, but in non-keratinized we only say stratum superficiale. Okay, so stratum corneum, it contains the keratin that may be orthokeratinized or the parakeratinized, and about this I have written later in this video itself, later in this note itself. Okay, so I will discuss in this video. So after that in non-keratinized oral epithelium, so stratum superficiale, it contains the nucleated cells. They contain less number of the tonofilaments and lack the keratohyalin granules. Okay, so stratum superficiale, okay, so there we can see the nucleated cell, but in this keratinized oral epithelium we don't see the nucleated cells. Okay, so there is an absence of the nucleated cells. Okay, but there is a presence of the keratin, which is absent in this non-keratinized oral epithelium, and less number of the tonofilament is present here, but it is more in this keratinized oral epithelium, and lack the keratohyalin granule. Especially these keratohyalin granules are present in granulosum layer. Okay, but also I have taken this line from Orban's. Okay, so you can just understand simply. Okay, so less number of tonofilament are there, and keratin also not present there, and nucleated cell is there. Okay, after that this cell ultimately desquamate as do the cornified squam. Okay, so this is one of the common feature between the keratinized and the non-keratinized oral epithelium. Means that, so in keratinized also, okay, there is a desquamation, and this non-keratinized oral epithelium, they also desquamate. Okay, so this is a feature of the oral epitheliums. Okay, and also in the intestine. Okay, so there is also a desquamation. Okay, after that in the permeability, so it is less permeable, so it is less permeable, and protective barrier is formed by this oral epithelium, and it is more permeable non-keratinized oral epithelium. Okay, so these points are easy to understand. I think you can remember them easily. After that in stratum basal, okay, so in stratum basal we have cuboidal of the columnar cells, and they are mitotically active. Similarly in the non-keratinized oral epithelium, they are similar, okay, to the keratinized oral epithelium. Means stratum basal, okay, in the layer of stratum basal there is not much difference in the keratinized and the non-keratinized oral epithelium, and they have they have also mitotically active cells, okay, but the rates of the mitosis is higher in this non-keratinized oral epithelium, and it is not much active in this keratinized oral epithelium. But means that, okay, so in keratinized oral epithelium also there is a mitotically active, but when we will just compare, okay, where the mitosis happen much, then in non-keratinized oral epithelium there is a higher rates of the mitosis. I think you understand this. After that, in stratum spinosum, okay, so prickle cell layer, okay, so stratum spinosum is a prickle cell layer, and polygonal cell with desquamate, okay, polygonal cell with desmosome, sorry, okay, so polygonal cells are there in stratum spinosum in keratinized oral epithelium, and we have discussed with this in detail in the previous video, okay, I think you have watched that video. After that, in stratum spinosum, okay, so particularly stratum spinosum is absent in the non-keratinized oral epithelium. We have stratum intermedium, okay, and stratum intermedium in the in replacement of this stratum spinosum. So the cells are larger than the cells of stratum spinosum here, and absence of the prickly appearance, and they do not contain some intermediate do contain some intermediate keratin filament, but differs biochemically, okay. So I have taken all those points from the Orbans, okay, so all those notes are taken from the Orbans, so I will be covering properly whole text of the Orban, okay, so that all the text, okay, all the things that are present in Orban I have covered, I have included all those points in my notes, okay, so you shouldn't have to be worried. And so here in this stratum intermedium cells are larger, okay, so this is important, okay, so the cells are larger here in stratum intermedium in comparison to the stratum spinosum. Similarly, we do not have prickly appearance, okay, so we do not have pricky appearance, not spiny appearance is present here in stratum intermedium. Also, it do not contain do contain some intermediate keratin filament, okay, so this is very important. Intermediate keratin filament is present in this stratum intermedium layer, but it differs biochemically, okay, so you can just remember the cells are larger, prickly appearance is there, and intermediate keratin filaments are present in the stratum intermedium layer. After that, stratum granulosum, okay, so the granular layer is there, and flattened cell keratohyalin granule is present in the stratum granulosum, okay, so stratum granulosum or the granular layer, so flattened cells keratohyalin granules are present in the keratinized oral epithelium. After that, in the non-keratinized epithelium, okay, so stratum granulosum is absent here, and the incomplete or vestigial granules may be seen in the non-keratinized oral epithelium, okay, so we have covered the proper difference between the keratinized oral epithelium and the non-keratinized oral epithelium, and some of the notes are present here, okay, so first point, okay, so keratosis, okay, so I have found this term in the Orbans, okay, so I have included in the note, and those are important terms, okay, so they can be framed into the MCQ questions, so you should have to learn those points. So keratosis means when keratinization occurs in the normally non-keratinized tissue, okay, so simply non-keratinized tissue is there, but when the keratinization happens, means deposition of the keratin takes place, then at that time it is called keratosis. And parakeratosis means normally keratinizing tissue, okay, so normally keratinizing tissue such as epidermis becomes the parakeratinized, okay, so they are very simple to understand, but you may get confused, okay, so after watching this, after looking this point, okay, I think you will be clear in upcoming days. So keratosis simply means the keratinization is happening on the non-keratinized tissue, and the parakeratosis means normally keratinizing tissue like epidermis, okay, they become parakeratinized, okay, so properly keratinized tissue is there, that becomes parakeratinized, means properly keratinized become less keratinized, okay, so that is a parakeratinized, okay, so that is parakeratosis. After that, we have orthokeratinization, okay, so orthokeratinization means cells have only keratin, okay, so cells have only keratin, like tonofilaments is also there, okay, large number of tonofilament is present there, okay, and no any organelles is present there, absent of the nuclei, and seen in the areas needing maximum protection, okay. So in orthokeratinization, okay, you just have to remember that the superficial layer contain only keratin, okay, there is no any chance of nuclei, no any chance of cells, okay, so if there is not cells, then how the organelles will be present at that place. Okay, so there is no any organelles, there is no any nuclei. Okay, so that layer is just dead and keratin is just deposited there. Okay, and those are seen in the maximum protection area like gingiva. Okay, okay, so like gingiva, as I have discussed here in this paper. Okay, so gingiva and hard palate. Okay, so in those places they are masticatory mucosa and we require the larger forces, so we require the tissue that could resist the larger forces, so that there is a orthokeratinization. And in the parakeratinization, cells have keratin filament, but it is a less in number than that of the orthokeratinization, but presence of the pycnotic nucleus is present there. Okay, so this pycnotic nuclei is important here, that to remember. Okay, so parakeratinization means there is also a keratin and the tonofilament, but it is less in number than that of the orthokeratinization, and there is a presence of the pycnotic nuclei. Okay, and organelles are there properly absent. Okay, in the orthokeratinization, but it is somewhat okay little present in this parakeratinized. Okay, so we can see little amount of the cells there, and that contains less number of the organelles. Okay, and this is very important, orthokeratinization and the parakeratinization. Okay, so you should remember this: keratosis, parakeratosis, orthokeratinization and the parakeratinization. Okay, so after this, now we will discuss with the other topic of this chapter, that is basement membrane. Okay, so basement membrane is also one of the most important chapter, and lot of times in theory exams, okay, they are asked as a short note. Okay, so you should prepare this topic very well, and I prepare this note from the Orbans properly. Okay, so you just remember all those points, take the concept and sit in your memory. Okay, so basement membrane means it is between the epithelium and the connective tissue, appears structureless a band in the H&E stain, H&E preparation. Okay, so it is just between the epithelium and the connective tissue. Okay, so if this is a epithelium, I think you know this. Okay, so if this is a epithelium and this is a basement membrane, okay, upon which the epithelium is laid, upon which epithelium is present, and this is a connective tissue. Okay, so especially this connective tissue is called lamina propria. We will be discussing that. So this is a lamina propria, and basement membrane is separating epithelium and the connective tissue, and it appears structureless. Okay, so it appears the structureless in the H&E preparation and stain positively with the periodic acid sip method indicates the presence of the neural mucopolysaccharide or the glycosamine. Okay, so it stains positive. Okay, okay, so it stains positive in the periodic acid sip method, which means that there is a presence of the neural mucopolysaccharide or the glycosamine, and this is important for the MCQ question. Okay, so due to presence of this neural mucopolysaccharide, there is a positiveness in this type of stain. Okay, so periodic acid sip stain, and this is a famous stain. Okay, and ultrastructurally called basal lamina. Okay, and after that appears thick and includes the reticular fibers with 1 to 4 micrometer wide and is relatively cell free. Okay, so they appear thick and they include the reticular fiber. Okay, with the 1 to 4 micrometer in wide and relatively cell free. Okay, so they are 1 to 4 micrometer wide and they are quite cell free. Okay, after that there are some functions of this basement membrane, and this is a general functions of the basement membrane. Okay, so I think you have studied this about basement membrane function in the general physiology or pathology. Okay, but also we will discuss little bit here. So it promotes the differentiation. Okay, so it promotes the differentiation, growth of the epithelial cells. Okay, so it promote in the differentiation. After that it also promote the peripheral nerve regeneration and the growth. Okay, so for the regeneration and for the growth of the peripheral nerve, okay, it just promote that. After that it prevents the metastasis, and this is very important. Okay, so I think you have studied about this metastasis in the general pathology. Okay, so in neoplasia, so this metastasis, okay, so it means breaching of the basement membrane. Okay, so if the cancer cells, okay, so if they break the basement membrane, then that type of cancer is called malignant type of the cancer. Okay, and this is just a simple concept, I think you know that. So breaching the basement membrane leads to the metastasis, and those metastases are present in the malignant type of cancer. Okay, so this basement membrane, they just prevent the metastasis. After that, in next point, as I have written here, it is made up of the two zones. Okay, so one is lamina lucida and another is a lamina densa. Okay, and this is very important, you should learn this. So we have a properly two zones in the basement membrane. Okay, so one is lamina lucida and another is lamina densa, and in the lamina lucida, so it is called clear zone, and in the lamina densa it is called dark zone. Okay, so how to remember? So here is a lamina lucida means L, so L means clear. Okay, so here is L here. Okay, so L is present in this clear. Okay, so we can remember like that way. So lamina lucida, so it is a clear, and lamina densa, so D is here, so it is a dark zone. Okay, and it is below the epithelial cell and it is adjacent to the connective tissue. Okay, so this is just below the epithelial cell, means that. So first of all, okay, I will show you here. Okay, so first of all there is epithelium. Okay, after that there is a lamina lucida, after that there is a lamina densa, and after that there is a connective tissue. Okay, so this is a pattern. Okay, so I have also written the text of this lamina lucida here. So lamina lucida, they are 20 to 40 micrometer wide and glycoprotein layer. Okay, so they are 20 to 40 micrometer wide, nanometer. Okay, and the thickness of basement membrane was 1 to 4 micrometer, and this is nanometer, and 20 to 40 nanometer wide. The glycoprotein layer is present in this lamina lucida, and it contains the type 4 collagen and an antigen bound by the antibody KF1. Okay, so this is a antigen. Okay, antigen bound by antibody. Okay, so that is KF1 antibody, and type 4 collagen is present here. Okay, so this type of question mainly they ask in the MCQ. Okay, so during the preparation of the objective, during the preparation of the MCQ exam, you can learn those points. Okay, so they are very important for the MCQ exam. And during those lectures, okay, I usually used to tell, okay, so this can be framed into the MCQ question, so you should have to just catch that. Okay, and you can note it in a copy. Okay, so that will be easy to remember, that will be easy to revise. Okay, when we are going to just prepare the MCQ, when we are just going to prepare for any kind of objective patterns exam. Okay, objective exams. Okay, so contain a type 4 collagen and antigen bound by the antibody KF1. Okay, and contain the laminin and the bullous pemphigoid antigen. This is also important. Okay, so laminin and the bullous pemphigoid antigen is also present here. After that, this laminin, okay, so they are large triple chain molecule, and laminin and the type 4 collagen are helping in the promotion of the epithelial cell growth. Okay, so which is one of the function of the basement membrane. Okay, so in the lamina lucida, you just remember that it is a layer that is just beneath the epithelium. Okay, it means it is the upper layer of the basement membrane, which is 20 to 40 nanometer in thickness, and it contains the glycoprotein, with also it contains the type 4 collagen with the antigen bound by the antibody KF1, contains laminin and the bullous pemphigoid antigen. Laminin is a large triple chain molecule, and with the type 4 collagen it promotes the epithelial cell growth. Okay, so that is very easy to remember. Okay, so lamina lucida. After that, lamina densa is there. So lamina densa means anchoring fibrils that contain type 7. Okay, type 7 collagen form the loop and are inserted in the lamina densa. Okay, so I'll show you the picture. So just remember, there is a anchoring fibrils, okay, that contains the type 7 collagen, and this is very important. Okay, so anchoring fibrils are present there, which contains the type 7 collagen, and those anchoring fibrils, okay, so they form the loop. Okay, so loop is formed there. Okay, so intermingleness of the anchoring fibrils is there. Okay, so those forms the loop, and those loops are inserted in the lamina densa. After that, type 1 and type 2 collagen fibers run through the loops. Okay, so this type 1 and type 2 collagen fiber, they just get incorporated in those loops of this type 7 collagen anchoring fibrils. Okay, so that is a just simple term. So type 1 and type 2 collagen fiber, they just get intermingle, or they just run in the loops of the type 7 collagen fibers. Okay, and type 4 collagen, okay, so type 4 collagen is also present there, that is coated with a heparin sulfate in the chicken wire configuration. Okay, so chicken wire configuration, So this is a famous configuration. Okay, so I think you have studied about this in a pathology, general pathology. Okay, so in cancers. Okay, carcinoma, sarcoma. Okay, so type 4 collagen, it is coated with the heparin sulfate, and they are present in the chicken wire configuration. Okay, so this much is for the lamina densa. Okay, after that, first of all I will show you the picture. Okay, then I think it will be more clear. Okay, so in this picture, and this is a picture of the Orbans, so you can see here. So okay, so it is visual. So these are the tonofilaments. Okay, so these are the tonofilaments, and this is a basal cell. Okay, so this is the epithelium here. Okay, so this is epithelium, and it is attached to the basement membrane by the hemidesmosome. Okay, so these are the hemidesmosome, and in the previous video I have discussed about this hemidesmosome, desmosomes. Okay, so this hemidesmosome connects the cells. Okay, basal cells with the basement membrane. Okay, so this proper. Okay, so this total is the basement membrane. Above is the lamina lucida, and below it is lamina densa, and in the lamina lucida we can see the glycoproteins. Okay, and it is 20 to 40 micrometer, sorry, nanometer thick. Okay, so as I have mentioned here, 20 to 40 nanometer wide. Okay, glycoprotein layer. Okay, so we can see there lamina lucida, and after that in this another layer lamina densa, we can see these fibers. Okay, so these are the fibrils. Okay, so they are collagen fibrils. Okay, so those collagen fibers are attached to the lamina densa. Okay, you can see the attachment here, and among this collagen fiber there is a type 1 and type 2 collagen fiber are running. Okay, so they are intermingled in this type 4, type 7, sorry, type 7 type of collagen. Okay, anchoring fibrils. So this is the ultra structure of this basal lamina, and you can draw this picture in your exam. Okay, to get the full marks. Okay, and this is present in the Orbans. Okay, so after in exam, okay, when you will write this much text. Okay, and after that you can draw that picture, then you can get a proper marks in your theory exams. Okay, so okay, so now we will discuss with this lamina propria, and I think about this lamina propria you have been studied properly in the general histology. Okay, so but also in this oral histology, so lamina propria, it is just simply the connective tissue beneath the basement membrane of the variable thickness which supports the epithelium. Okay, so this is a definition of this lamina propria, and we have two particular parts. Okay, so we have two parts of this lamina propria. One is a papillary and another is a reticular. Okay, so about this papillary and reticular I will draw a schematic diagram. Okay, so just think this is a basement membrane. Okay, and here there is a epithelium. Okay, so these are the epithelium present here. Now below this basement membrane. Okay, so this is just a schematic diagram, but when you will see the picture, okay, so those basement membrane are not like this straight. Okay, so there is a ridges present there. Okay, so we can see like this ridges. Okay, so like this ridges are present there, and we can see the epithelium in this manner here. Okay, so here there is a epithelium. Okay, and below this, okay, so below this basement membrane, so we can see the connective tissue. Okay, so all over there is a connective tissue. So these are the connective tissue. Okay, so this papillary and this reticular. Okay, so this portion is also lamina propria, and this portion is also the lamina propria, because it is separating the epithelium with the connective tissue. Okay, but this portion, okay, so this much, so this much portion, okay, which is in between those ridges. Okay, so they are the epithelial ridges, and between those ridges the connective tissue that is present is called the papillary type of lamina propria, and below this papillary type there is a reticular type. Okay, so below this tip of the epithelial ridges. Okay, so below this tip of the epithelial ridges we have the reticular type of the lamina propria. Okay, so we have two different parts of the lamina propria. One is papillary, another is reticular. Papillary lamina propria is present between the ridges. Okay, epithelial ridges is present there, and in between those ridges there is a papillary type of lamina propria, and below the tip of this epithelial ridges we have reticular type of the lamina propria. Okay, so we can remember now this. So I have written here about the papillary part. So it is between the epithelial ridges and may be absent if the ridges are not present. Okay, and it is in alveolar mucosa. Okay, so in alveolar mucosa there is not much ridges present there. Okay, so epithelial ridges are mostly absent in this alveolar mucosa, so that there is a less papillary part. Okay, and it is absent there. After that, in reticular part we can see here. Okay, so it is always present in this reticular part, and they contain net like arrangement of the collagen fibers. Okay, so in the reticular part we can see here. Okay, so they are always present, and as they are not related with the epithelial ridges. Okay, so they are always present in the oral mucosa, in the connective tissue, and it contains the net like arrangement of the collagen fibers. Okay, so there is a collagen fiber present there in this reticular part. Okay, also there is a other substances. Okay, in ground substance we can see all those components is there. Okay, so now we will discuss with the components. Okay, what are present in those ground substance of this lamina propria. But first of all, as I have written in this point, epithelial ridges. Okay, so they are for increasing the areas for exchange and making the attachment tighter. Okay, so epithelial ridges, so they are mostly for increasing the area for the exchange and for making the proper and strong attachment. Okay, so that is the function of the epithelial ridges. And now we will discuss with the constituent contents of this lamina propria. So the main contents and main constituent of the lamina propria is the glycoprotein and the proteoglycans. Okay, so they are the major constituent of this lamina propria. And in the proteoglycan we have hyaluronone, heparan sulfate, versican, syndecan. Okay, so those are the proteoglycans that are present in the lamina propria, and you can remember those. Okay, they are the they are those proteoglycan. They are mostly coming in all the topics. I think you have remembered this also in while I was discussing the cementum. Okay, so there was also those proteoglycans present. Okay, so this is a quite of a common proteoglycans that are present in oral mucosa. Okay, so once you remember this, you can apply those proteoglycans in other part too. So just remember. So glycoproteins and proteoglycans, hyaluronone, heparan sulfate, borsican, syndecan. Also we have cells, fibroblast, mast cell, macrophages. Okay, so there are the inflammatory cells. Okay, so fibroblast is also present there. We have mast cell, we have macrophages present in the ground substance of the lamina propria. After that we can see the type 1 and type 3 collagen fibers are present in the lamina propria. Okay, so this is very important. But in the lamina densa, as I have discussed, okay, so the type of the collagen is also important to remember. So in the lamina lucida there was type 4 collagen. In lamina densa there was type 7 collagen forming the anchoring fibrils, and type 1 and type 2 were just running through those loops of the anchoring fibrils, and type 4 collagen was also present there, that was coated with the heparan sulfate. Okay, and here in this type 1 and type 3 collagen is present there in lamina propria. After that, elastic fibers present in the lining mucosa helps to restore tissue after the stretching. Okay, so elastic fibers, okay, are also present in this ground substance of the lamina propria. After that, lamina propria may attach to the periosteum of the alveolar bone, or it may overlay the submucosa. Okay, so this is also important. So sometime what happens there is that, okay, so lamina propria and below the lamina propria there is submucosa. Okay, we have studied in that pattern. Okay, in previous video I have prepared the table from the Orbans. Okay, so there was submucosa below the lamina propria, but sometime there is absence of the submucosa and it is directly attached to the periosteum of the alveolar bone. Okay, so same thing is written here, so you can remember in such a way. So in this lamina propria, just remember that. Okay, so we have two major parts. Okay, so papillary part, reticular part. Papillary part is in between the epithelial ridges, and the reticular part is below the those papillary part. Okay, and the reticular part is always present, but papillary part may be present or may be absent. And in the glycoproteins and the proteoglycans are the major constituent. Also there is the type 1 and type 3 collagen present there. Also in the cells, okay, we have fibroblast, mast cell, inflammatory cells like macrophages, mast cells are present there. Elastic fiber is present there, and sometimes it can be attached to the periosteum, but mostly it is attached to the submucosa. Okay, in downside, in the below side. Okay, after that lamina propria we will now discuss with the submucosa. okay, and this is quite of a common topic. Okay, so these are also discussed in general, okay, general basic science subject, in general physiology, general anatomy, general histology. Okay, we can discuss with those topics. So in submucosa, connective tissue of the varying thickness is present there. Okay, so with the in oral mucosa itself, okay, so the thickness of submucosa differs. Okay, so connective tissue of varying thickness, okay, is present there, present, okay, in submucosa. After that, contents of the submucosa, we contain nerve, blood vessel, glands and adipose tissue are present in this submucosa. Okay, so this is important. So we have four important component of the submucosa. One is nerve, another is a blood vessel, another is a gland, another is a adipose tissue. Okay, so those are the contents of the submucosa. And there is a profuse blood supply, and it is maximum present in the gingiva. Okay, so same here, so it can be framed into the MCQ question. Okay, so just note this. Okay, so maximum blood supply of the oral mucosa is present in the gingiva. Okay, so this will be very helpful when you will prepare for the PG level examinations. Okay, or any kind of objective based exams. Okay, that can also be held in your university exam, so this will be very helpful. Okay, when revision, so you can note this. Okay, so glands and adipose tissue, nor blood vessel, sorry, so maximum amount is present in the gingiva. Okay, so maximum amount of the blood supply is present in the gingiva. Okay, after that, in some mucosa larger arteries, okay, so it divides into the small branches which then enter the lamina propria, here again divide to form a subepithelial capillary network in the papillae. Okay, so in submucosa there are larger arteries which get divided into the smaller branches, and they enter into the lamina propria's reticular part, and after that it again enter into the papillary part of the lamina propria, where it forms the subepithelial capillary network. Okay, for the exchange of the materials. Okay, so they are for the exchange. And the nerve fibers are also present there, which are myelinated, okay, but lose their myelin sheath before splitting. Okay, so when they give the branches and when they enter into the lamina propria, okay, so at that time the nerve fibers, they are becoming the non-myelinated. Okay, after that, in the last point, specialized receptors for the cold, that is Krause involved, and for the touch, Meissner corpuscles and free nerve bindings are found in this submucosa. Okay, so those type of receptors are also present in the submucosa. Okay, so in overall, you just remember submucosa contains the blood vessel, nerves, lymphatics and adipose tissue. Okay, and I'll show you the picture, then I'll discuss more. So so in this picture, okay, so here is the oral mucosa. Okay, so this is non-keratinized. Okay, so this is buccal mucosa. So you can see stratum superficiale and the cells are alive. Okay, so there is no any kind of keratin present there. Below this stratum intermedium is there. Okay, and this is the epithelial ridges. Okay, and below, between those, they are the lamina propria of the papillary part. Okay, and this whole is the reticular part of the lamina propria, and this part. Okay, so this part, they are the submucosa. We can see the submucosa containing the muscles, okay, fat, salivary gland. Okay, so everything. Okay, so salivary gland, nerve, blood vessel, muscles, okay, connective tissue strands are present there, which divides the submucosa. Okay, so all those constituents are present in the submucosa. So this is a non-keratinized type, and here this is a keratinized type. Okay, and mainly, okay, so you can see the difference. Okay, so the epithelial ridges are quite a flat here. Okay, but it is like cylinder. Okay, it is like finger. Okay, so it is just like villi. Okay, so in the intestine there is villi. Okay, so finger like projection is there, so similar like that. So you can see here finger like projection here. Okay, so this is non-keratinized. So this is a keratinized type of the epithelium and gingiva. Okay, so we can see the long thin ratty ridges here. Okay, and here is just shown lamina propria, but submucosa is absent here. here it is more visible. Okay, so this proper structure is the submucosa, and below this, okay, so periosteum is also shown here. Okay, so this is periosteum, this is whole structure is submucosa, this is lamina propria, and this structure between the epithelial ridges are the papillary part of the lamina propria, and this is the epithelium. Okay, okay, so I think now you are clear in this topic. So I have discussed with the, okay, so now at the last, okay, so we have discussed with the keratinized and the non-keratinized oral epithelium. Okay, so we have discussed with the difference between them, and in those difference itself, okay, so we have discussed with this non-keratinized oral epithelium. So I have mentioned all those points that are present in the Orbans. After that, we have discussed with the basement membrane, and in basement membrane also we have discussed properly about the lamina lucida, lamina densa. Okay, and the constituent of them, and how the fibers are arranged. Okay, how the loops are formed. Okay, in the lamina densa. After that, basement membrane we have discussed with the lamina propria, and in the lamina propria we have discussed with the two different part, papillary part and the reticular part. And after that we have discussed with the submucosa, which is quite of the general topic, and I think you have studied this in the general histology too. Okay, so the things are quite similar in oral mucosa and the general histology. Okay, so you can remember like that way. So after this, we have completed this video. Okay, so after this video we will continue with the other remaining topics of this oral mucosa membrane or oral mucosa in the other parts of this chapter. And this much for today, and we will meet in the next part. So tata, bye bye, thank you.